The chair would now recognize Congressman Wadiwagan.
Talofa, and thank you, Chairwoman Fernandez and Ranking Member Young. Talofa also to Chairman Grijalva and Ranking Member Westerman for holding this hearing today, and thank you, of course, to the panel for your testimony. Chairman Costin, the end of your testimony highlights the need for increased broadband and internet access on your reservation. We see the same problems in other rural areas across the country. Besides increased funding, what needs to be done to accelerate broadband development on reservations and in other rural areas?
Well, I think first of all, that with this funding, there really needs to be a greater flexibility and recognizing that each tribe, the needs of each tribe are unique. Here at the Caldwell Reservation, we have 1.4 million acres, and we have 2 mountain passes on our reservation. And so, there's a lot of issues of having, bringing broadband onto our reservation. Many providers, don't want to come onto the reservation, first of all, because there are so many challenges in really looking at understanding and working with tribal governments. And also, there are many regulatory and legal issues that need to be addressed, so many that I think that is something that we will reply in writing to. But it has been a huge impact on our reservation. And realizing, that about 90% of our reservation does not have broadband access. And so it's really, when you think about, our young people, our school-aged children, it's an unequal access to education because they just don't have the resources that many other areas do. And then too, both Berry and Okanagan counties in the state of Washington, there are high unemployment rates here, and they are 2 of the most disadvantaged counties in the state. And so, one of the discussions I remember earlier was to really even look at broadband becoming a utility. I think that could be something that could be worth considering. Many of our parents here said that even if they had broadband access, they don't know if they would be able to afford to pay for that service. And, so, there are many challenges here on our reservation. Then too, many of when you talk about telemedicine, many of our people, don't have access to broadband. And even, especially our elder populations and our vulnerable populations, getting them used to, healthcare, via the internet is something they're just not used to, even if they have access to the internet. So that and looking at right to privacy, and then also looking at what tribes can charge for, on a face-to-face versus, the telemedicine, via the internet. I know that they said that earlier that we wouldn't be able to charge as much, because many of our programs are cost reimbursement, contracts with billable services. So I think that's something, that needs to be looked as a fix going far into the future. So I think really just having that greater flexibility and being able to look at, everything, all the needs across, both for IHS and for the tribes. I just wanted to mention IHS, we are direct service tribes, and, the spend down, they have to spend their funds down as well by the end of this calendar year. So that does not allow them greater flexibility as well for us to really develop programs like telehealth and telemedicine. So, those, I think, really looking at working with, FCC, the broadband mapping, there's so many inaccuracies with that as well. Even though they've got areas that they claim to cover these large swaths of areas, in reality, most of our reservation doesn't have any coverage at all. And so, not only that, but there's a lot of different challenges that the tribes do face, especially here, for not only in the pandemic, but also, like you said, with the wildland fires and for safety and security as well. And I think even looking at, other alternative communication systems is something that needs to be addressed. So I see the time is getting near. So we do plan on providing this in writing as well. Thank you.
Thank you, Madam Chairwoman. Yield back.